Good afternoon. Thank you all so much for joining us today for this great and timely webinar. A reminder before we get started, this is being recorded and will be made available on community.franchise.org later today. As well, if you have any speakers for today, or if you have any questions for today's speakers, please put that into the questions box and we'll get to that at the end. So first, thank you so much to PhRMA for sponsoring today's session. And the topic is how a healthy workforce empowers employees and benefits employers. So I'm going to kick it over to Michi Iliazzi with PhRMA, who's going to take us into the speakers and the content. Michi?
Thank you so much, Caitlin, and thank you to IFA for once again hosting another webinar with PhRMA. We really do appreciate all the work that IFA and their franchises do. Wanted to just really quick introduce our panelists for this panel. We're going to be talking about healthcare in the workforce and how it benefits employees, but also how it empowers employers and the relationships that's involved. Joel White is the president of the Council for Affordable Health Coverage. He spent years on Capitol Hill, including a previous stint working as staff director for the House Ways and Means Committee. Dr. Carol Granis is the Chief Self-Esteem Officer for Self-Esteem Brands. It's the parent company of Anytime Fitness, and she has over 25 years of experience in the HR, employee engagement, and training development sectors. Bill Bodie is the Chief Operations Officer for Planet Fitness. He joined Planet Fitness in 2016 as the Senior Vice President of Franchise Operations. And prior to Planet Fitness, Bill actually held several senior leadership positions at Dunkin' Brands. And finally, my colleague at PhRMA, Kevin Harris, serves as Deputy Vice President with our organization. And before joining PhRMA, Kevin served in many capacities in public affairs for over a decade, and he also did his stint in government in several capacities, including serving as the Executive Director for the Congressional Black Caucus. I'm really pleased to have everybody join us. I'm Michi Iliazzi with PhRMA, and I just want to really just start with Joel to talk about the importance of healthcare and how we talk about it in the employee-employer relationship. I think that's really important. We've seen a lot of things, particularly over the past couple of years with the pandemic, that have really strengthened that relationship and made it more important. So Joel, why don't you just talk to us about some of the important things that you've observed in your time and how you've seen this relationship really evolve over the last couple of years, and what are some of the flashpoints going forward that you may think you can see too?
Thank you, Michi, and I want to thank IFA. IFA is one of our members and a valuable member that helps us understand that relationship. And so CHC, our whole goal is to ensure that health costs go down so that people have access to a policy that they can afford. And we want all people to have affordable coverage. And I think one of the things that we've seen recently is that there's this misconception, I think, in Washington that most employers want to just dump their benefits and dump their employees so they don't have to provide health benefits and other voluntary benefits. And we're actually seeing the opposite. During COVID, what we saw was that employers were actually adding benefits to attract and retain talent. And one of the reasons is that we've got a very tight labor market, right? Like we see a lot of people sitting on the sidelines. They're not entering the workforce. And using health coverage and other voluntary benefits like gym memberships and hospital indemnity, accident insurance, pet insurance, identity theft insurance. These other benefits are a way to really attract talent and keep them on the job longer, because it's very expensive to train and retrain workers. So that's kind of the first thing, and it's a misconception here in Washington that employers just want to get out of this game. Employers, for the most part, want to do right for their employees, and they see benefits as a critical way to making that happen. But the challenge with employers, I think, is that costs are rising, right? And so it's hard to provide these benefits and still maintain a healthy bottom line. And I think that, one thing that kind of crystallizes this for me is that since 2010, the medical cost trend has grown by about 92%. What that means is that that cost trend, which drives premiums, has grown about 5 times faster than wages and inflation. And deductibles have grown by about the same amount, which means that you got a fixed pot of revenue for an employer that either comes out of wages or it comes out of health benefits or it comes out of the bottom line. And what we're seeing is a lot more deductibles getting pushed onto workers, and that's making things a little bit less affordable. So most of those costs that get added into that premium are in the hospital sector or the physician sector, but about 10% are in the pharmaceutical sector. And the interesting thing is, I think what we're seeing with a lot of employers is that they're trying to figure out, how do I impact that 10% of my dollar on the drugs to make the hospital spend and the physician spend go down? And the reason they're doing that is that they know if that they can get the prescriptions into the hands of their employees, they can stop disease progression, they can keep people healthier, they can prevent chronic illnesses to the point where people aren't going to the emergency room, they're not going to the hospital, they're not getting very expensive care. And the challenge there is really making sure that people are adherent to their medicines. What we know is that about 60% of all Americans live with a chronic illness. About 2/3 of patients don't take their medicines as prescribed. More than 1 in 5 new prescriptions are left at the pharmacy, right? It's really hard to take a prescription that you can't afford. And about 125,000 Americans die due to medication adherence issues. That's a $100 billion problem every year. So what we're seeing is employers are starting to adopt strategies like comprehensive medication management, where they're partnering directly with a pharmacist to help that employee understand the value of those medicines and to address cost issues so that they can be adherent to their medicines and resolve any problems. The other thing we're seeing is that there's some different coverage arrangements that employers are starting to use to make sure that they can afford this insurance coverage. And one of those things is using stop-loss insurance, using ICRAs or individual coverage HRAs to really create some flexibility in what their employees can take up. And then I think a lot of telehealth has been used during COVID to help people get access to pharmacists and to doctors to get their prescriptions so that they can be adherent and not have to go to more expensive settings. So that's kind of a big overview of what we see in the employer market. Obviously, we can drill down into all those details.
Thank you, Joel. I really do appreciate those insights. And I love that you mentioned the pandemic at the end, because I want to pivot to Carol on this, because I know that, in the experience that, Carol, you've had, not just in your role, but also in your educational career, you've got your doctorate. You've really dealt a lot with individuals, and you've seen what's gone on in the pandemic in terms of the health and wellness space. And really, what has it taught you? What have you seen coming out of the pandemic when we look at, employees, employers, benefits, and the idea of taking advantage of these things? What has it taught you?
Well, the good news, Michi, is that I think there was an alarm bell all across the world, and HR professionals like myself that were asking ourselves, are we doing enough? And back in the day, and I love you said 25 years, dang it, it's been 32 years I've been in HR, but back in the day it was paycheck and benefits, to your point, Joel. And now there is a larger meta view of how we're looking at the employee experience. So it goes well beyond the paycheck and health benefits, because we all understand that a team member that has good health and well-being contributes in such a positive way to a successful organizational climate, but they also contribute in a positive way to their own families and to the world. So at Self-Esteem Brands, we have a unique employee value proposition. We had it pre-pandemic. Our mission is to improve the self-esteem of the world. So my job is to ensure that that is how our employees are showing up. So it sounds lofty and like, ooh, that sounds really fun and cool, but there's actually some specific operational things that we've been doing. COVID kind of accelerated this work, and it made it, for any of my colleagues that were naysayers of the things that we were implementing in our culture, it made them say, oh, I guess that is important. So as you talked about, Joel, the Great Resignation era that we've been reading and talking about is a real thing. And it's another kind of amp up for HR and leaders to be saying, what are we doing to keep our great talent? And why are we losing our talent? Because it's on us. And so I want to share 5 quick things that I believe, like in this last year, our turnover has just gone up about 2 or 3%. And I'm pretty proud of that. And I think it's these 5 things, and the first 4 are free. So if you are an employer, get ready to write some notes down on some things that we believe are game changers. The first is using Gallup's research on employee engagement. We teach it, we talk about it, we make leaders talk about it with their employees. Where are you engaged? What is hard on your job? What do you need more of, less of? And we make sure that our employees are aligned to jobs that they're really good at. So we love the Strengths Finders 2.0. We do that every year for all employees. The second, and this sounds silly, is in the pandemic, I did not realize how important one-on-ones were. With a hybrid workforce and people needing a sense of belonging and connection, I made our one-on-ones mandatory. So you should have seen the eye rolls of our leaders like, ugh, I hate one-on-ones, but we shifted the model. So it starts with employees sharing their 2 feeling words with their boss. Now I'm in Minnesota, we call it Minnesota nice, but it's really Minnesota passive aggressive. Everything is smiley. We don't really share our feelings as well as our East Coast friends, but the sharing of the 2 feeling words was an immediate connection in between the leader and the employee, and having the leader understand what that person needed. The third is forcing people to take time off. 4 years ago, we said we're going to do unlimited PTO, woo! But what we knew from the research and our own practices is that no one was taking it. So now we are forcing people. I'm telling you, we're using the word forcing. And in 2022, I'm going to figure out what that week is, and we're going to force people to take it. But if you're older like me, you get more than, most people, because I've earned it. The other little thing we've done through COVID is institute no meeting Wednesdays. People need a space where it's not just meetings and you're on Zoom meetings that is draining all day long. You need to use your brain. But the big game changer for us at Self-Esteem Brands has been a tool called Modern Health. My bosses, our founders, Chuck Runyon and Dave Mortensen, asked me at my one-on-ones, they'll say, what do you worry about, Carol? And in the heart of COVID, I worried about the stress, anxiety, depression, suicide rate that was climbing here and around the world. And I did not know what to do about it. And so, Joel, you'll love this. I went to our EAP. Every benefit has an employee assistance program for people to get a therapist. Our usage rate, which has been the usage rate for 30 years of my career, was less than 5%. I never understood that. So we finally dug in to figure out what was going on, and people could not get access to therapists and counselors fast enough. So Modern Health is an app that all of our employees have. It offers you 8 therapy sessions and/or 8 coaching sessions to coach you forward on anything. I'm telling you, we have a 40% engagement rate. It is bananas. There's live webinars for diversity, equity, inclusion on all different topics for belonging, and it has been a game changer. And this week, we just offered it now to the dependents of our employees that are covered in our insurance and our health plans. And people are emailing me and so excited and thankful. If you are a parent that's been trying to find a therapist or a counselor during this last 2 years, it's been very difficult. So this changes the way that people have access to care. So that's all I had for my opening.
Well, I think that's, really insightful, and it's really helpful because it's a perfect, way to kind of get into what I wanted to ask Bill about, because Carol, talked a lot about, someone as an employee and what they're contributing to the workforce, what they're contributing to their company. But, there are steps that we take in our personal lives to be better people, to be better workers, to be better for ourselves, better for our family. And I think, Bill, you have a lot of experience in that, and coming, looking at it from the perspective of, what Planet Fitness has done and things that, your folks offer. Can you talk a little bit about the individual and really the idea of making those decisions for yourself and wanting to live a better life, improve on your health and wellness? Oh, Bill, you're on mute.
You're right, I was. Thank you.
That's okay. Happens to all of us.
Well, thank you, Meek. So thanks to the IFA and PhRMA. I think, when I think about our mission is to bring fitness to everyone. Essentially, Planet Fitness wants to democratize fitness. We've been in this space since 1992. Our founder, Chris Rondo, that's what he set out to do. He set out to democratize fitness, bring it at a great price. It hasn't changed in the 30 years we've been in business. Today, we have 15 million members in 2,200 locations. The key is we provide a judgment-free environment where anyone can see themselves in other members in the facility. That's important. I think, fitness isn't easy. So I think if you brave taking the step through the doors, you want to feel comfortable. You don't want to feel intimidated in the environment you're in. 40% of our members have never been a member of a gym before. So that kind of gives you some indication of how difficult it is. We look at our competitor, it's a couch. It's really not other fitness facilities. Many fitness facilities are really about getting fitter and not trying to get somebody off a couch. That's something we focus on every single day. I think fitness generally isn't easy, right? If you think about it, there's some work involved in it, but it doesn't have to be difficult. And I think that's the important learning for employers and people and employees. Introducing employees to fitness, even in our own environment, is difficult, right? So think about it. We're a fitness company. We have a fitness facility in our office, but we still need to encourage fitness in many ways and help encourage our employees to think about fitness. We hold quarterly contests in our office just around steps, how many steps you take a day, how many steps you take a week, trying to set personal records for yourself. Just, again, trying to educate and then encourage fitness. We provide step trackers so that people can track, that they're moving around, that they're standing, that they're walking, that they're taking those steps. We encourage increased physical activity. So I think we encourage people to check into our gyms. So if you're an employee and you check in, there's points for you for doing that. It gives them dollars off in our corporate cafeteria or on other items that we might have. We have workstation treadmills throughout our facility so that, again, encouraging people to, while you're doing something on your laptop, just walk along at a pace that's comfortable for you. We have desks that allow people to sit or stand. Again, all these are little steps toward, taking away more sedentary type activity, which generally increases your health risks. So we think, just those little type things to do that any employer can do is beneficial. This all helps our employees with both physical and mental well-being, right? Leading to a more focused, energized, and productive workforce. Like I said, we say our competitors the couch. We believe fitness is a part of the healthcare delivery system. I jokingly, we say it often in our office that we are part of healthcare. Most healthcare is actually sick care when you think about it. But fitness and your physical and mental well-being is really part of healthcare, and taking care of yourself is the most important thing you could do. Just a fact, we have 2,200 locations. There are still, within 10 to 12 minutes of those locations, there are still 140 million people that do not have a membership to any fitness facility, not just ours, but any fitness facility. It just tells you that people need to be encouraged and educated about the benefits of fitness and what it can do for you. Employers need to continue to provide opportunities in learning about those benefits.
Yeah, I think that's, part of, what the pandemic taught us too, is that there are so many things that, when we talk about access and we talk about opportunity and we talk about choice and things like that for people in the space of health and wellness, there's still a lot of work to do. And the pandemic really taught us that. And it's perfect that we can kind of pivot that point over to Kevin, because Kevin has spent a lot of time looking at these issues and helping to address the problems that we have when it comes to health equity and looking at how we can improve upon the outcomes that we want for all communities. So Kevin, I would love for you just to talk about a lot of the work that you do in that space, because it really relates well when we talk about the millions of employees that are a part of the IFA family, because they come from all shapes, sizes, and backgrounds and walks of life.
Definitely. Thank you, Michi, and you're absolutely right. One of the things that we are very much focused on here at PhRMA is health equity. We have an entire health equity initiative, and a big part of that initiative is fighting for policies and reforms that would help to sort of stem some of the gaps that we see when it comes to access to care and some of the barriers that people face to accessing treatment, particularly in the clinical trials process. And so definitely that sort of macro effort is definitely needed, and is something that we are definitely focused on here at PhRMA. But what I love about what has been said so far today is the importance of employers also sort of working on that individual level with their employees. And not sort of dismissing that. A lot of people look at the size of the problem and say, well, that's such a big problem. I don't know that there's any little thing that we as a company or I as an employer can really do. And that's just the wrong sort of approach, right? We need all hands on deck to really sort of address some of the inequity that we see in healthcare, and employers are critically important to that work. And not only is it a good thing to do, it's a smart thing to do, because as both Bill and Carol and Joel have mentioned, when you do that, it does have an impact on productivity. It does have an impact on sort of making sure that you're not sort of churning through employees. People tend to want to stay in their jobs longer. That has an economic impact. And also, when you deal with these things proactively, you do see a return on investment in terms of lower healthcare costs, because people are healthier. And so we definitely need that. We need employers engaged on this. And I think the pandemic has really just sort of helped to sort of refocus that. I think before the pandemic, people saw these types of things as nice to haves. It's something that, you know, if we can do it, if we can sort of pay attention to that, we will. But the pandemic has sort of made it a necessity that we sort of prioritize diversity, equity, and inclusion in the workplace, particularly when it comes to healthcare. And the companies that sort of already were focused on that before the pandemic, they're ahead of the curve, and they've been able to really sort of weather it a lot better than a lot of other companies that are sort of coming a little late. And the reason that it's important, particularly to focus on health equity, is that just like the country is getting more and more diverse, that means the workforce is also getting more and more diverse. So if you want to attract employees, if you want those employees to stay, if you want those employees to be able to give their very best, then you have to sort of take an interest in health equity, as well as some of the unique barriers and unique challenges that are there for different segments of our population. I think the other thing that's important, and I think it may have been Carol or either Joel that sort of mentioned this, in terms of, you know, the Great Resignation. People are being a lot more selective now about where they go work and where they want to spend their time. What that says to me is that you know, people want to feel valued as human beings. They don't want to just be valued on sort of just what they can produce in terms of helping the company's profits. They want to feel valued as human beings. And when you have a workplace that is welcoming, that is focused on your health, that is focused on helping you have the tools that you need to be healthier, right? That makes a person want to work there. That makes a person want to be a part of the team. And notice I said team. They feel like it's a team, right? It's not I'm not just here. I'm just not, you know, I'm not just another person that's just coming in just to sort of help the company. We're part of a team, and it helps people take pride in what they're doing. And so I think that is an important thing. The other thing too that I will say is that you just look at the research around health equity in companies that sort of prioritize this. It increases productivity, as we've mentioned before, that ultimately reduces healthcare costs for everybody. It's a win-win for employees and employers. And so when it comes to sort of looking at health equity, it's no longer can we go to the sort of pre-pandemic days in particular, where it was sort of like this is a nice to have. It is a necessity. The workforce is getting more and more diverse. Issues around diversity, equity, and inclusion are more and more important to workers. They want to work in a place where that is valued. And if you are an employer and you can meet that need, if you can meet both of those, it does have benefits for your bottom line, right? Employees want to stay longer. Employees are more productive. It ultimately reduces your health care. And the last thing I will sort of say about it is, a lot of times when we talk about diversity, equity, inclusion, people think that is about certain groups. They think that that's about certain segments of our population, minorities or women. And the truth of the matter is, what we're finding in the research and just as society as a whole, even if you are not in one of the impacted groups directly, people still want to work in a place where they know that their colleagues who are in those impacted groups are also valued. And so it is not a carve out. It is not something that you sort of are doing for one group or the other. If you want a unified workforce that is productive, that, you know, is more productive and in long term sort of helps to reduce some of those healthcare costs. Prioritizing diversity, equity, and inclusion, understanding your workforce, helping them to have access to a lot of the wonderful things that Carol and Bill mentioned in particular. Those are all smart strategies. And it is something that employees now are demanding. They look at that. Like Carol said, it's not just about wages and benefits anymore. It's wages, benefits, and also how am I going to be treated as a person if I go work there, and how do they treat other people?
Thank you, Kevin. I think that really does kind of provide a great summary into not only the work that you do, but a lot of the work that we're seeing from a lot of companies in kind of this space and why it's important from a healthcare perspective, from a health and wellness perspective, and kind of a going forward perspective. I've got some questions in the queue, so I want to kind of throw them out there, but while ask someone to start, I want everybody to know that the questions that I see in here, they're for everybody. It's more of a conversation. So while if you feel compelled to chime in, please do, because we've got a good amount of time to discuss this. But first, I want to start by asking Carol this, because after we've heard all of what we've seen, Carol, what do you look at as an opportunity for the health and wellness space? And do we see kind of a chance for like a renaissance coming out of the pandemic? Because you saw a lot of people who were not able to make certain choices in the health and wellness space. You talked a lot about the uptick in, suicide and mental health problems. So coming out of the pandemic, as we see more treatments, as we see more therapies, as we see vaccines, and we see the effectiveness, what could come out of that for the health and wellness space where we can see improvements on that for employees, employers, individuals?
Yep, I want to acknowledge, to answer that question, that COVID hit us and then George Floyd was murdered. And so we've not acknowledged that there was a social uprising. And I'm telling you, as an HR leader, when we were talking with my colleagues in other industries or here in the Twin Cities, when that happened, we all stared at each other like, what the hell? And that's when there was this reckoning, as you shared so beautifully, Kevin, that people want to work at a place that has values that are aligned to their own values. And so to your question, Michi, it is around caring about the whole person. So we do a confidential assessment of a person when they are joining us to ask all parts of their life. We use the aggregate data to push development opportunities. So in 2021, the most requested topic of all of the areas of health and wellness, if you think physical, emotional, spiritual, educational, financial, relationship, your own mental health, financial wellness, and mental health were the top two. And so that's when we brought Modern Health in. And then we also brought in financial experts to work with our employees to help them bring down debt, figure out how they're going to pay off those student loans. So to me, Michi, to your question, the renaissance is I'm looking at the entire person. I'm not just looking at the output of what their job is for me at the organization. I'm looking at the whole person. And I don't know that I see it as a renaissance, because the research 10 years plus has been this movement towards caring about the person as a whole person. But I think COVID and the social uprising accelerated the button. So to that point, looking at the person as a whole person is what I would share.
So Bill, would you add anything to that from the perspective of, the space that Planet Fitness is in, and, looking at it from the individual perspective, do you see opportunities more for folks coming out of the pandemic to have the ability to make those choices? And obviously the ability was there before, but did the pandemic do anything to make it a little bit more of a crystallization and something more of an urgency for folks in terms of the health and wellness space?
So we think so. We've seen mental health issues well on the rise as we've gone through COVID. So I think between the mental health issue rise, people realizing that if you have comorbidities, if there are issues in your health, that taking care of your health is now more important than ever. It was most people who had the most serious issues with COVID were people with underlying health issues. So now people are more than ever aware of that and aware that they have to take better care of themselves for their physical and mental well-being. We think that on top of the lack of socialization that happened during COVID. So we were all confined to our homes. We couldn't get out. We couldn't socialize. Humans want to socialize. So we think that's an opportunity that as people come out of COVID, there'll be pent up demand for socialization. They'll want to be out in the gym with others. They'll want to be out eating. They'll want to do things socially. On top of the fact that they're now more aware than ever of taking care of themselves is important.
Yeah, I think that's spot on. Joel, I would ask you to kind of just build on that if you can, talking about, going forward in 2022 and really kind of the flashpoints for the employer-employee relationship, and kind of bringing into this idea that people are far more cognizant now of the importance that the health and wellness space is, not just to them as an employee or how they're productive they are, but how they're living their lives and how that's going to matter to them and their family going forward.
Yeah, I think I'd point to three primary things as drivers that we're hearing from our employer members. The first is, when I talked about the Great Resignation and the ability to attract and retain talent, there's a huge sign outside the McDonald's right down the street from my house that says $15 an hour starting salary plus benefits. We're hearing from other franchisees, they're offering up to $20, $21 an hour for hourly workers. Look, it's a strategy to get the workforce that people need to do the jobs is the first thing we're seeing through COVID. The second thing is that when we all switched to Zoom or Teams or whatever we were doing, that impacted our mental health, right? It caused anxiety, it caused stress, it caused increased sedentary lifestyles. It really affected us in significant ways. And then the isolation component of COVID really exacerbated some of the mental health issues and substance use issues, right? Like alcoholism and opioid and fentanyl use and other issues. That was the second thing. And the third thing was that as people were less able or less willing to access in-person care, they really did switch to telehealth almost immediately. So those are three primary drivers that I think our employers saw. And they said, oh, well, what do we do to capitalize that going forward? And I think the strategies that we're seeing in 2022 are really built around those three primary issues. So first, there's survey data on this. Almost 85 to 90% of our employers view voluntary benefits as a core total reward strategy for their workforce. Okay, and that's increased significantly over time during the pandemic. Secondly, they're finding it's easier to offer voluntary benefits. Like there are apps for that, right? Like there are ways that you can access your benefits via your smartphone that have driven the administrative cost down of offering those benefits. And the third thing is an attitude shift, and that is employers are starting to view offering these benefits, whether it's telehealth or pet insurance, right? Like pets are a huge mental health benefit for people, okay? Pet insurance is critically important to owning a pet. Employers are offering that as a strategy to help with mental health. So the attitude is enriching those existing core benefit plans by offering more personalized benefits is an 80% strategy for some of our employers. Secondly, it's an overall well-being approach. 77% we surveyed in a survey showed that that's part of the approach. 74% say attracting new talent, but then 74% in employee well-being. And the other interesting trend that we're seeing, I think we'll see in 2022, is in the past, these voluntary benefits were offered to full-time employees almost exclusively. Employers are now very interested in offering these new benefits to part-time or excluded employees, and that's a way to attract and retain talent and improve overall well-being.
So, Joel, that is actually a really good point, because you see a lot of folks taking on multiple jobs, people figuring out where they want to be, how they want to work, figuring out the hybrid model or what do they do. So it's really important that employers are adapting to the new normal, whatever that may be. Something you brought up that was really very critical that I want to ask Kevin to weigh in on is you talked a lot about some of the problems that people had that they were dealing with when it came to the health and wellness space, and you see these problems of addiction or these problems with people in communities where these safe spaces are not there and people are not able to rely on their community for help. Kevin, I know you deal a lot in the health equity space when we're dealing with communities, regardless of whatever background folks are coming from. There are challenges that they're facing in their community. There are challenges that they're facing as an individual, and there's challenges that they're facing outward, whether that comes from problems that they may have with family, problems that they may have with addiction, problems that they may have in education, not getting the education that they need. But how do you see that? Because you talked a lot about the strides that were made over the past year and during the pandemic, but how does that relate to the challenges going forward in the health equity space?
Well, I think, the way I would say that it relates to the challenges going forward is that, I think the pandemic has given us an opportunity, right? It's given us a moment to really sort of shift course here. And one of the things that Carol spoke about earlier, she said, a lot of this research has been around for years, but we were just waiting on that impetus to sort of move people to action. And so I think that as a result of the pandemic and the fact that the workforce overall is just diversifying, and the fact that people are sort of putting a higher premium on a lot of health and wellness benefits, you're seeing the employer community respond to that. But what you're also seeing, and Carol talked about this a little bit too, is that even though a lot of these benefits may have previously been available in some capacity, you had a lot of employees that didn't always take use of it, right? And so now we're in sort of like this moment where you have employers and employees both on the same page and are both in sort of dialogue about that this is a necessity. It's a necessity for the company to do well, but it's also a necessity for me to be able to do well as an employee and to choose you as a place for where I would want to work. And so in terms of the challenges ahead, to me, how this all relates is that we've been given an opportunity here. I think we're off to a good start. I think employees and employers are responding positively. And if we can really sort of stay focused on that, stay attuned to that, don't sort of fall back into some of the bad habits that we had before the pandemic, we can really gradually start to chip away at some of the broader inequities that we see in society, particularly when it comes to healthcare. And it has very real ramifications, as Bill talked about. A lot of the folks who were disproportionately impacted by the pandemic were folks who had underlying health conditions, and a lot of those folks were disproportionately women and people of color. And so a lot of those folks, if that underlying inequity had not been there, when COVID hit, a lot of folks would have been in a much stronger position to be able to weather it and survive it. And so, as this sort of relates to us sort of moving into the future, having that symmetry there is critically important. It's important not only for our workforce, but it is also important for sort of how do we address the broader sort of inequities that we see in our healthcare. And employees and employers definitely have a role to play in that conversation that we're having as a nation.
I'd like to add on, if I can,
go ahead,
Kevin's point. In the height of COVID, we kept hearing, right, that the working mother and people of color, right, as you said, Kevin. And so yep. I think that employers just need to be intentional, and what we are trying to do is be intentional with asking and having the conversation. So I put together talking points for all managers to share with their employees. I just want to check in with you, and I want to ask you some questions. How are you doing? What's getting in the way of your mental health? And I know some of you are like, wait, what? I'm not a therapist. I'm not a counselor. It's not that. It's just being curious about what you're needing. And then we had a session for our managers on how to support when they're in those conversations. We're like, whoa, I don't know what to say. Hey, have you thought about reaching out into Modern Health? There's therapy and coaching available for you. And it seems like this could be a time where you need some support. One thing, Michi, back to I like the word renaissance. If COVID and the social uprising of the last 2 years have done anything, it's gotten us out of our, knowing that uncomfortableness is okay, but to have the conversations, to have courage to check in and not turn away.
So I want to ask you actually, because I did want to ask you, Carol, before, and it's perfect that you mentioned that, because this is part of what I did want to ask, and I would like for Bill to weigh in after, because this really it kind of gets to the individual. You know, as you've looked at how to have those conversations and how to make sure that you're checking in. Look, Kevin knows I do a weekly check-in with my supervisor, and it's actually fantastic. It is one of the best things that I've ever had, and I've never had it at a job. And it's perfect because it allows me the ability to bounce off the kinds of things that I'm feeling as an employee, what kinds of pressures I'm feeling, but what kinds of things I can improve on. And so my question for you is, how do you get, you know, the employer, if they're feeling in a place where they don't feel like getting into that kind of conversation, how do you get them comfortable to be in that kind of place? And Bill, I would follow up to say, how do you get the individual involved to really want to talk about the improvements that they want to make as an individual with their health and wellness? Like, how do those two things work?
I have a funny story. So like everybody during the pandemic, we do these video town halls. Here's what's going on in the business. Don't worry, we are strong. It will be okay. We'll help our franchisees. And then I thought, well, we need connections. So we're going to do breakout rooms. And it's just, how are you? And so what I found out of, like, you know, we'd have 600, 700 people on the call. When we would decide to do the breakout, we'd drop 30%. So we know that some people do not want to talk about their feelings. And so we acknowledge that. And some people, though, want to. So what we were doing is just offering the opportunity. So I do talking points, then we practice with our managers. We share, how's it going, what's going on. But we also just try to make light, because the message is we want to reach you where you are at, and we want to support you in any way that we can. So we try to take the pressure off of it. Bill?
Yeah, I'd say the same. I think Carol said it well. I think, you know, if you talk about your renaissance, if you think about trying to get individuals to all of a sudden share their feelings, that is not going to happen. I think that is an evolution of time, and it's the culture you create in the workplace that ultimately gets that to happen, not a statement, not one-on-one, right? It's the fact that you start to build those behaviors over time as an employer that builds a culture of behavior like that, that ultimately gets people comfortable in that environment. And when they're comfortable in the environment, they'll be comfortable with themselves. And that sounds very prophetic, but I think that's really what you have to accomplish in the workplace. It's changing the culture to allow for that.
The good news or bad news for our employees is I've been around almost 5 years. They know that they're going to be, they know we're leaning into, how are you?
So Joel, I would ask you to weigh in perspective of when we kind of take it up to a more higher level and think about the idea that, you know, as the employer-employee relationship is shifting and it's adapting, you know, what are employers really wanting to make sure that they're getting out of employees when it comes to the health and wellness space? We obviously know that they want to attract them. We obviously know that they want to retain them. But what more are they trying to get? You know, productivity, obviously, but productivity how? You know, certainly health and wellness, and, you know, showing up on time and being a go-getter. But what about the real meat and potatoes of that employer-employee relationship, and what the employer really is trying to get out of their employee these days?
It's a two-way street. I would say, first of all, it's not just what the employers are trying to get out of their employees, it's what the employees want from their employer. And smart employers understand that dynamic. And I think the smart employers are thinking about three primary things. The first is they want their employees to be happy, right? Happy employees are productive employees. So they want productivity, but they also want that happiness component, because happy employees do better work. They're more productive. They're you know, they have better work-life balance, etc. So it's happiness, productivity, and the third thing is connectedness. Okay, people want to connect what they do at work to a larger purpose. So it's not, and we see this particularly in younger generations, millennials in particular, that if they feel like they're making a difference and they're impacting the world in some specific way, they are going to be not only happy, they're going to be way more productive. And so you say, like, how do I do that if I'm at a McDonald's or at a Chick-fil-A or you know, Walmart or something like that? And the answer is, people feel connected and they feel mission driven when their supervisor empowers them. And so all of these benefits that we're talking about are just things that we could lay on the table, and then, absent what Carol and Bill are talking about in terms of engaging people and being where they're at, if you don't do that, it's all kind of meaningless. You're just putting stuff on the table and people grab it or they don't. If they're connected in meaningful ways with their manager, with their supervisor, with their employer, and you give them purpose, connectedness, and you make the environment a fun environment, a happy environment, a healthy environment, and you kind of connect the dot between their productivity and gains at work, those employees really take off, and they become the managers one day, right? Like, because they are seeing a future. And we all want that as human beings. We want to know that we're having an impact on the world. We have a purpose, and our work is important, meaningful, and it's leading to a better future.
So
Joel,
Kevin, yeah, go ahead, Carol.
I was going to say that was brilliant, Joel. And purpose is so huge, and what we love, and the franchisees, I think, are great in this in every industry, in connecting their business to the community, to the high school, to the whatever's needed. Our franchisees and others, they are really good at that, and that is a amazing retention tool. So Joel, perfect. Purpose is a big deal.
So Kevin, I would just
ask, I didn't
sorry.
mention. Sorry, Michi. One thing I didn't mention, I do have a friend who owns 4 McDonald's franchises. And one of the things that he did was he modified their retirement benefits and put 100% employer, not a match, 100% employer contribution, max contribution to each employee. And so it wasn't that he was just saying, if you put in, I'll put in. He was saying, this is important to your future. I'm committed to you. I'm going to put in the maximum contribution to your 401k that I can, free and clear, right? So those employees, I said, why did you do that? He said, I wanted them to know that I'm going to invest in them. And that's then makes it easier for me to run my operations, because they know they're bought in to the success of my enterprise. And it's worked out brilliantly for him. He has one of the lowest turnover rates in the area of any McDonald's franchisee.
So Kevin, I just wanted to try and see if you had any thoughts, because Joel talked about wanting to, make the employee happy and make the employee feel like, they were part of the process and make them feel invested in it. How does all of the work that you've seen and you've done as it relates to health equity, how does that play into that employer-employee relationship? And is that a part of, we discussed earlier, wanting to work at a place that really values those values, that really cares about those values? How does that play in, and how far have we come on that?
Yeah, I think that the way it sort of plays into it is one of the things that we've all sort of touched on throughout the discussion today, is that people want to feel valued. They want to work where they feel valued, and they want to actually find value in the work that they are doing. And as Joel said, that is particularly the case when you see millennials and younger people as well coming into the workforce. They put a very, very high premium on that. And so how it sort of feeds into the broader sort of health equity space is that if you have a company that can sort of match people there and meet people there in terms of values, in terms of vision, and in terms of mission, right? And if that same company is also takes an interest in wellness, then you do start to see an impact in sort of reducing some of the disparities that we just see, that we see in society, and that we do a lot of work to try to address here at PhRMA on sort of that macro level. And even the example that Joel just mentioned about the 401k. I know we're talking a lot about health disparities here today, but there's also a lot of economic disparities as well. And to have there's not a lot of places where folks can go where you're going to have a boss that's going to do that. So not only is he seeing low turnover, he's also taking a step as an employer to also help address some of the income and economic inequality that we see in society. So it really just sort of just goes to show that when you sort of marry all of those things around mission and value employees, and you marry that with taking an interest in sort of the wholeness of a person and the workforce that you were seeking to retain and to attract, it does start to play a role in sort of these broader sort of conditions that we are seeing in the country. And I think it just, again, just underscores that there is no role or no contribution that's too small. These are big problems, but there's no contribution that is too small. And so to have employers zero in on this, again, great for the bottom line. It gets people there. It makes people want to stay. It makes people want to be productive at work. But you're also doing something really, really good for the country and helping us to sort of chip away at a lot of the disparities that we see.
I didn't want to interrupt in case anyone else wanted to weigh in on that, because I was doing that a lot last.
I would just add, purpose is not hard to figure out. You just give people space to go do the purpose work that they want to do. It might not be their job. I have right now about 10 or 12 employees that are having a Christmas party with a local small business owner, minority business owner who is in St. Paul in an underserved area. And we did a toy drive and gift cards and Christmas party, and they're having a ball. And so I think a lot of times, especially if you're a smaller employer, like, I don't have the means or the people to organize. People will organize it themselves. That's this millennial group is like, put me in, coach, what do I need to do? And you just get out of their way.
Yeah.
And Generation Zs, I forget about them.
So Bill, you know, with 2022 coming up and everybody wanting to make a lot of resolutions and a lot of improvements, and I know obviously in the fitness space, January, the first weekend day after the new year, when I go to my gym, it's always busier than it's ever been. And then I say, just give it a month, and you know, the stragglers will kind of just go back to the couch, as you say. So what would you look at kind of going into the new year, kind of the tips and resolutions that you might want to give to employers and employees as they look at what's coming in the next year and things that they can improve upon in their relationship, and how, you know, Planet Fitness as an example is looking at those issues?
Yeah, I think, you know, a lot of it's been said, but I would suggest that, you know, Carol hit on a couple of points earlier that I want to make sure I repeated because I thought they were point on. You know, this is really about who's their manager at the end of the day. You know, employers can create great cultures. They can put great programs in place. They can do a lot. But at the end of the day, that manager that manages that employee is the one who's empowering. It's not the organization, it's the manager. It's the one who's giving the positive feedback. It's the one that's giving the time and space to do things that they want to do. If I thought about it, I think that's what I would suggest is really important. I think from a resolution perspective, I would say, you know, fitness is essential. Think about what we came to talk about. I think caring about people's personal, physical, and mental well-being is very important as an employer, and more important today than ever for all the reasons I said earlier, because they care about it, and caring about what your employees care about is important as an employer. And it is top of mind for the world today that their physical and mental well-being has been attacked over the last couple of years, and they want to rebound from that attack. And our opportunity is coming, and we need to take advantage of it. As people, as a culture, we need to take advantage of it. Employers fit in that, but as a culture, we need to take advantage.
So I would kind of just go around and ask everybody to weigh in on that idea of kind of moving forward and the resolutions and tips. And I'm going to do it like the Hollywood Squares and go a little bit clockwise. So Joel, I'll go to you, kind of pivoting off of what Bill said and kind of heading into it from your perch and, you know, the folks and stakeholders that you deal with. How do you see it in 2022 and kind of the tips and resolutions that can be helpful in this health and wellness path and this partnership between employees and employers?
Yeah, well, I'll do a micro level and a macro level. So at the micro level, I love resolutions. I'm a list guy. I make lists for everything, and The way I think about it is there's 4 primary buckets in life: your physical, your mental, your emotional, and your spiritual. And if we do things in those buckets every day, we will be healthier, better human beings. And so if you think of as an employer, what am I doing for my employees in one of those buckets or all of those buckets each and every day to improve my workplace? You will create a healthier work environment, a better work environment, a more productive work environment. At a macro level, what I hear, I'm in Washington, D.C., we're an advocacy organization. I don't know about you, but every Thanksgiving, every Christmas, every holiday that I go to, or whenever I'm with my family, there's this angst and this tension, right? Like, what the heck is going on in Washington? Why can't they figure these things out? Why can't they do what's right for the country? I think engaging in the political process is a healthy outlet towards resolving some of that angst, and there's right ways and wrong ways to do that. And I think that talking to your member of Congress while they're at home, writing a letter or an email and sending that in to express your perspective in a respectful way is very, very healthy. So if there are issues with franchises, with businesses, et cetera, weigh in and let your decision maker know how you feel, but do it respectfully. There's lots of stuff happening in the health space that is good. There's lots that's happening that's bad from a public policy standpoint. Be active, weigh in.
Thank you, Joel. Kevin?
Yeah, I think for me, it would be like we've talked about how the pandemic and a lot of the social unrest that we've seen across the country, how that just created a moment for us, right? To really sort of get moving on doing some of the things that we've known for a long time needed to be done. And so for me, it would be, let's just make sure that the moment isn't fleeting. That we really use this as an opportunity to really sort of galvanize and sort of move forward in a unified way to deal with a lot of the inequities that have existed in our society for a long time. And I think that, as has been shown throughout the conversation we've had today, is that that's not just a good thing, because it feels good or that morally it's the right thing to do. It's actually smart. It's smart for business. It's smart for employees. And so this is really a win-win. We know it works. So let's just use this as a moment to really sort of galvanize our energy and make some change.
Thank you, Kevin. And last but not least, hopefully to give us the positive self-esteem note that I think we all want, Carol, I'll give it to you.
My title was Chief Self-Esteem Officer. I said it's too much pressure, so I changed to Builder. Sometimes I don't know what the hell I'm doing. But I echo all of what you've said. It's been brilliant to be with you. One of the things for our franchisees out there, let's just acknowledge you made it through a pandemic. Our small business owners, franchise owners, some are larger multi-club owners or multi-store owners, but many are independent unit owners, and you made it through a pandemic. So that is worthy of celebration. I love the focus on people, purpose, profits, and play. And I can't believe I'm doing this, but several years ago, there was a book written called Love Work, and it was written for the franchisee, and it's activities in all those spaces that we've been talking about that are free. It's called Love Work, but sending love out to you was very brilliant to be with all of you today.
Well, thank you to all the panelists. I really appreciate everybody's insights, and this was a really important topic to cover, I think, and I really do appreciate all the work that IFA has done. So I'll turn it over to Caitlin to close this out.
Awesome. Thank you so much, Michi. And to Carol, Kevin, Joel, and Bill, thank you all so much for your time. And to everybody on the line, thank you so much for spending your afternoon with us and investing in your professional development and education with us and with this topic. It's very important, and I think this was a great conversation. So thank you so much, and thank you so much to PhRMA again for your sponsorship of this and providing the content. So a reminder, this was recorded. It will be made available on community.franchise.org later today. And then a reminder that IFA's annual convention is happening February 26th to March 1st, San Diego, California. Registration's open now, and so come join about 4,000 franchising professionals, education, and many networking opportunities in exhibit hall. Please come learn and network with more of us. So thank you all again so much on the line here, and thank you to our attendees. Everybody have a great rest of your day. Stay safe, stay healthy. Thank you so much.
Thanks all.
Thank you.